My name is Hannah. I will be your provider today. I will be doing a full exam of your head, ears, eyes, nose, and throat, and your chest, your lungs, and your heart. So I'm going to start out with inspecting your head. Everything looks nice and intact. Your hair looks like it's intact. Your scalp looks great. Everything looks symmetrical, no lumps, bumps, or scars. Now I'm going to palpate your temporal pulses. Wonderful. Okay, now I'm going to be checking some cranial nerves. Can you raise your eyebrows for me? Can you close your eyes nice and tight? Great, you can open them. Can you give me a big gummy smile? Amazing. Okay, can you give me a frown? Can you puff out your cheeks for me? Awesome. Now I'm going to palpate your masseter muscles. I'm going to be checking for any clicks or any pain there. So open, close, open, close. Okay, everything felt nice and smooth. I didn't feel any clicking, any pain with that. No? Okay. Now I'm going to have you close your eyes and I'm going to be checking some other cranial nerves. You let me know when you feel this soft touch on your face and where.
Left forehead, right forehead, left cheek, right cheek, left chin, right chin.
Great, you can open up those eyes now. Now I'm just going to be looking at the external structures of your eyes, your eyelashes, your conjunctiva, your sclera, subconjunctiva. Everything looks great. A little bit of redness going on, but overall eyelashes look intact, and your eyes look great. Now I'm going to be testing for accommodations, convergence, and ELMs. So I'm going to have you follow my finger with your eyes. Don't move your head. Okay. And that one was convergence there at the end. Everything looks great. Now let's move to the next. So now I'm going to be checking for your red light reflex in the more inner structures of your eye. So I'm turning off the light and I'm going to be shining a bright light in your eye, okay? I'm going to start about 12 inches away from this right eye. I'm just going to hold up and I see that red light reflex. And now I'm just going to take a look at those inner structures. I see the macula fovea, the cup and disc, and those vessels look great. Okay, now I'm going to do the left. So I'm just going to hold red light reflex about 12 inches away again. And I see that macula and fovea, that cup and disc, and those vessels. Now I'm just going to be checking for direct and consensual accommodations of your pupils. So I'm going to have you look over my shoulder, and it's going to be a bright light. Okay, I see that both are reacting. All right, next side. Wonderful. One more time. Okay, great. Those look all good. Now I'm going to be taking a look at your ears. So I'm just going to do an outer exam of your ears. They look nice and intact. No redness or crusting. Any issues with hearing? Okay. So now I'm going to be testing your ability to hear doing a whisper test. So I'm going to have you cover your right ear with your hand, and I'm going to whisper into this ear, and you tell me what I say. Dog.
Dog.
Cat.
Cat.
Squirrel.
Squirrel.
Okay, next one. Dog.
Dog.
Cat.
Cat.
Pigeon.
Pigeon.
Great. Nice and intact. Okay, so now I'm going to be taking a look inside of your ear. So I'm going to use my scope here, and I'm going to pull your pinna up, out, and back. So I'm looking at the tympanic membrane to see if there's any cerumen. So up, out, and back. Okay. See a little bit of cerumen, no major redness. I see that pearly white looking tympanic membrane looks nice and intact. The outer and inner canal look clear and non-reddened. Now I'm going to take a look at this one. So up, out, and back. I'm going to take a look. Okay, see a little cerumen, no major redness, and a nice pearly intact tympanic membrane. Outer and inner structures look great. Okay, can you hold this up for me a little more? Okay. Now I'm going to be taking a look at your nose. So I'm just looking at the outer structure. It looks nice and symmetrical and intact. Underneath looks good. And now I'm just going to look at the patency of both of your nostrils with the light. They both look nice and patent, no major redness or anything there. Now I'm just going to look up. I'm going to be looking at your turbinates, your septum. Okay, looks great. Your septum looks nice and straight, no protruding turbinates or masses. Okay, so sorry. Okay, same on this side. Everything looks great, nice and pink, no major redness or swelling, and your septum looks nice and straight. Now I'm going to be taking a look at your tongue and your mouth. So I'm looking at your lips, your teeth, your gums, your buccal mucosa. Open up for me. Okay, looks great. Teeth are nice and intact. Gums look nice and pink, and your buccal mucosa looks wonderfully pink and healthy and wet. Okay, now I'm going to look under your tongue with my tongue blade. Looks great. I'm going to look at your tongue. Stick it out for me. Great. Okay, unfortunately, I am going to have to give you a little gag to check your gag reflex, but first I'm just going to look at your hard and soft palate. They look great. I'm visualizing pink and vascularized tissue, no erythema. Okay, alright, I'm going to gag just a little bit. Check your uvula. Okay, great. Uvula moved concentrically in the back there. So sorry. Okay, now I'm going to be taking a look at your neck. It looks like it's nice and symmetric. Your trachea is midline, no major scarring. Now I'm going to be feeling for your lymph nodes. Okay, I'm going to start in the back up here with your posterior, occipital, and cervical lymph nodes. Now the jugulogastric, submandibular, and submental, working down to the superficial cervical, deep cervical chains, and supraclavicular. Okay, now I'm going to have you do a shrug and I'm going to push down. Give me a nice shrug. Okay, wonderful. Now I'm looking at your trachea again, which I've already looked at. It's midline, there's no scarring. And I'm going to be testing your thyroid. So for this, I'm going to have you swallow some water and then you follow my directions. Hold it in your mouth, sorry. Hold a sip of water in your mouth and I'm going to be palpating your neck. So I'm going to find your Adam's apple here. Okay, I'm going to have you tilt your neck to the right, or your head to the right, sorry. Perfect. And now big swallow. Okay, the thyroid feels great, nice and soft. Okay, again, hold that sip. Okay, I'm gonna push, swallow. Okay, that thyroid is wonderful. Now we're going to move on to respiratory. So I'm going to have you take off your shirt for me. I'm going to have you take off your shirt for me. And first, I'm just going to do an inspection of your skin and your chest and your AP diameter. So it looks like your AP diameter is 2 to 1. No major scarring, lumps or bumps on the front or the back. Okay, everything looks nice and symmetric. Now I'm going to be percussing your chest. So you're just going to feel me tap in a few places. Okay. Okay. I'm going to do the same thing on your back. Would you be able to turn for me?
You want me to like
Yeah.
down?
That would be great. Okay. So, yeah, relax those shoulders for me. Okay, great. I'm going to have you sit back up on the bed. I'm going to listen to the front, and then I'm going to listen to the back. And every time I move my stethoscope, I'm going to have you take a nice big deep breath in and out. Oh, sorry. Okay, great. Sounds nice and clear. Now I'm going to be listening to the back. Same thing, nice deep breaths with every move of my stethoscope.
I'm gonna turn it the other way so they can see it.
Yeah, that would be great. I think you need to move a little bit. Okay. Can you tell? Okay. Alright. Nice deep breath. Okay, great. Lungs sound nice and clear. No wheezing, crackles, bronchi, or any abnormal breath sounds. Now,
Turn it again.
now I'm going to be moving on to your chest. First, I'm going to palpate your carotid pulses. So I'm going to do one at a time here. Nice and strong. Okay. Now I'm going to do the other side. Wonderful. Now I'm going to listen to those carotid pulses. I'm going to use the bell of my stethoscope. Okay. Great. Okay, they sound like they are nice and well perfused. Now I'm going to inspect your chest for any pulsation or heaves. You're kind of doing the position I need you to right now. So I'm going to have you lean forward. I don't see any pulsations or heaving going on. Okay, you can sit back up for me. Now I'm going to be listening to your chest. I'm going to be listening first with my diaphragm and then with my bell on the front, and then I'm going, oh yeah, just on the front. I forgot we're doing the heart. Okay, so it might feel like I'm listening for a long time, but nothing's wrong. I'm going to go through first with the diaphragm and then with the bell. And you don't have to do any big deep breaths or anything for this. Can you relax your arms and sit up for me? Thank you. Okay, now I'm going to listen with the bell. All of that sounded great. No adventitious heart sounds or irregularities. And that is my exam.